know Albertans are waiting too long for an ambulance to arrive to help in what may be someone's greatest time of need. Starting today, Alberta Health Services will use alternate modes of transportation for non-emergency transfers of patients instead of using ambulances where it's clinically appropriate to do so. This will free up ambulances and paramedics to respond to more emergency calls and to provide urgent care faster. It's important that these highly trained professionals can deal with actual emergencies and not shuttle patients from one place to another. This program has already been successfully piloted in a number of municipalities: Calgary, Bonnyville, Valleyview, Athabasca, and St. Paul for 6 months. The result of the pilots have already been clear. The program diverts 15% of ambulance transports, which will allow for an additional 70 responses a day province-wide. That means 70 more possible ambulance trips for actual emergencies every day. It allows our world-class paramedics to do what they were trained to do. And even more importantly, lives will be saved because we have more ambulances available to respond to emergency calls from Albertans, bringing paramedics to administer their excellent and life-saving work.
The application and the utilization of non-clinical transportation is something that has been utilized across the province in different forms. What we're going to be able to do with the announcement today is be able to standardize that. And so in consultation with patients, their care teams are going to be able to make clinical decisions about the movement of patients, utilizing the right resource at the right time to free up ambulances for their work. So this is really about streamlining the work and utilizing resources that we've got in community already.
It will give patients who are waiting for transfer more options to get home from the hospital or the emergency department, or to follow up on their appointments more quickly. When an individual is fully assessed and waiting to return back home in an emergency department, they're still occupying space in the emergency department. We need to have a very flexible, available system that can get them home, whether it's back in an urban setting or even far distance into the rural areas. I first became quite aware of the need for a non-ambulance transfer when I was discussing situations down in the Medicine Hat area. And there's no doubt that this new option is going to be wonderful to relieve that kind of pressure in the emergency departments. On the other hand, also, people who are fully assessed and ready to go home occupying an acute care bed, now that we have this new option, they're going to be able to get out of that bed faster and home, not waiting for ambulance level transfer, but can take advantage of this new non-ambulance transfer. It's going to be actually wonderful.